I first want to note the absence of the Minister, Stephen Donnelly. I know we can't be all in two places at the one time, but I think it's a bit of an insult that he's not here this morning to make a statement on this. But also to start by telling him and the present Minister that this amendment from the Government is among the most outrageous and misleading efforts I've seen in years, and it also has enraged the students who know the reality of their situation. Perhaps the most outrageous idea is that their work, their unpaid work in our hospitals and on the front line, is not as important now as it was in April and May. The reasoning is threadbare and flies in the face of the experience of the nurses themselves. They are working, plugging the gaps caused by the huge strains on our health service, now as they did in April and May. The difference is not that things are much easier now because of the better staffing or lower infection levels. The only difference is now you are not paying them anything. At the start of November, you told us a review of the allowances for placements was taking place. In this amendment, you take the fact that you still haven't improved the €50 a week now as some kind of positive. €50 is all you give to these workers. They may have to travel or live hundreds of miles from home in temporary accommodation, often with huge costs getting to and from their jobs. It's astonishing that over 4,000 workers at the front line in the fight against COVID are in this situation. The misleading amendment from the Government gives the impression that your motivation is to safeguard the education of these students. That assertion and the rest of your amendment has enraged those nurses, and if you think a vote here is the end of the issues, you're very much mistaken, because this campaign will continue. I noticed yesterday, as I look back at the coverage of the strike last year by the INMO, the abundance of photographs and smiling Fianna Fáil and Green Party candidates pledging their support to the nurses' causes. This betrayal to the next generation will not be forgotten or forgiven by these workers or their families. Part of this neglect and the outright abuse is because they are overwhelmingly women. If you think back over the years and the various strikes and battles that nurses have had, it has always been the case that the fact that this was overwhelmingly a female profession meant that they had to constantly fight for equality and parity with similar professions. The last strike in 2019 was centred around that demand for equality with other degree-based professionals. Their treatment then, and in previous disputes by governments and with the HSE, was based in belief on blatant discrimination and also downplaying the importance in general of the role of care and the caring profession in our society. It's no accident that these things are still overwhelming. These professions are still overwhelmingly female. Over the years in the debates in the Dáil, the issue of the treatment of student nurses has arisen time and time again. In 1998, in 2000, in 2011, in 2013, well before the pandemic time, and again student nurses and their reps have had to fight for the basic provisions. Mary Harney and a previous Fianna Fáil government at one stage wanted to remove all payments from student nurses in placement. Others tried to reduce it, and like many other public sector workers, they faced demands for cuts during the austerity years. Time and time again, the state has shown a history of contempt and disregard for nurses, for student nurses, and for the caring profession in general. There is a theme here that, for all the platitudes in recent months, nothing has changed. The most laughable claim in this amendment centres around improved staffing. The reality is, in much of this so-called improved staffing is temporary staffing and the increased use of agency staff. In October figures, we discovered that there are now almost 200 fewer permanent nurses in our health system than there was pre-pandemic. There were 41,572 permanent nursing and midwifery staff working in the HSE last December. This has now decreased to 41,370. There are just 2,289 temporary midwives and nurses working in the HSE in December last year. This has increased, almost doubled, to 4,026 by August of this year. And we know that much of this has been put through the Be On Call for Ireland plan, that many were recruited via agencies such as CPL with inferior contracts that exclude proper sick pay, proper access to other standards and conditions. Your promise to provide 1,146 additional acute hospital beds that cannot run without proper full-time permanent staffing levels. The numbers you quote are temporary and agency and will not address the ongoing staffing crisis in our hospitals. Your treatment of student nurses today nearly guarantees a continued hemorrhage of skilled staff from this country in the future. They will leave with bitter memories of their treatment to other countries where nursing staff are given respect and the pay that they deserve. So it's not the case that the issue of safe staffing has been resolved, and the reality on the wards is not what you have written in your amendment, which sounds as if the life of a student nurse is wonderful and they're able to concentrate solely on their education. They know the reality. The INMO know the reality, and you can stick your head in the sand and pretend otherwise. But that doesn't change reality. Additionally, we know that the high rate of COVID infections among nurses has continued, with 353 healthcare workers who contracted COVID between the 15th and the 21st of November alone. The reality that your decision to reopen from level 5 when the next lockdown arrives will mean that we'll see even greater numbers of healthcare workers infected, and this will place even greater demands on the student nurses that today you are treating with shocking contempt. Your policies on the reopening from level 5 has yet again guaranteed that another lockdown, another surge in infections and another crisis in our wards, central to paying the price for the failure to wrestle with the virus. And central to that will be the efforts of those student nurses. Your amendment confirms your treatment of them, once again, is contempt. By January, no doubt you'll be lauding the efforts of our healthcare staff. We'll probably even get up and clap them again in dealing with the failure of this government. Your words will ring hollow following your amendment today. The Green Party aren't here, but I want to say a word to them. It's become standard in these past few months for us to appeal to you, because we appeal to you on the basis of having stood in the election for the desire for change and having stood with the INMO pickets last year when you fought for equality and for decent treatment of workers. You professed and supported here in March and April, before you were in government, for the demands to pay student nurses. I'm appealing to you again here today. All that has changed from April to now is that you were in government. The lives and the needs of student nurses hasn't changed. The vital work that they do hasn't changed. The needs to pay the bills, to pay the rent, to live their lives hasn't changed. But now that you're in government, and this is to the Green Party, you cannot use that position to advocate for such a government. What is the point in being here? If you can't use that to advocate for the workers, what is the point of being in government? Is it to just get so-called green policies passed that exclude the people who are at the heart of them? If you can't save the planet by abandoning group after group of vulnerable people in our society, there's no point in being in government. I want to finish with a quote of a motion that was put to a city council recently. It's only fair and right that our student nurses are properly recognised and recompensed for the service to our communities during this pandemic. Right across the city, we have COVID patients being tended to by staff and their student nurse colleagues. The Health Minister must recognise their efforts at this most challenging of times and pay the student nurses with proper and fair wages. I agree. I hope all in this House would agree. But this is a Green Party motion that was put to Belfast City Council. Do they agree with their colleagues in Belfast? If student nurses in Belfast deserve decent treatment and deserve decent payment, then student nurses throughout this country deserve likewise. Minister, I think you made a very interesting Freudian slip when you were reading your speech, when you talked about that the nurses will be fully surprised that for certain periods during each of their training that they get the payment. What you meant to say was fully supervised, but fully surprised indeed they are.